press one.
Might be.
Shake it off. Shake it off. You seem a little out of sorts this morning.
Yeah, you know why? Because at 5:45, my wife decides that that is the time that we need to get a million things done in the house.
Uh-huh. What do you mean?
Like, when women are pregnant, weird stuff happens in their brain.
Well, pregnancy
Some
brain is a real thing.
some people call it nesting, but I think it's like nesting is just one aspect of the I'm getting close to birthing a baby. It's wild. I don't know how to explain it. They get an idea and this is what we're doing now. Like right now.
At 5:45? I mean, you had a full hour before you had to get here.
Yeah, but there's a lot that happens at the Rosenstock home in the morning because of Henry. Like, we didn't have a lunch prepared the night before for his school, so like I've got to get like a lunch packed for him. And I've got to put everything in a little.
It's called snackables.
Yeah. Henry eats better than most people. If we all went on the Henry diet, we'd be shredded. No, it's just like bulk trash is coming today, so she's like, you got to take all this stuff out. And she's like,
Why not yesterday?
well, yesterday I wasn't home. Well, I napped.
Well, you were home, except you decided to have a 3-hour fucking lunch
It
break
was
yesterday.
not 3 hours.
It was.
I left at 1:15. I
You
got
left
back
before that.
No, because I came back in and I had lunch with you guys. It was
Oh,
1
that's
o'clock.
right. Yeah, and then you came back at 3, essentially.
It was a 2 hour. But there's drive time in there. There's like 20 minutes there, 20 minutes back.
Yeah.
And then, yeah. Anyway. There's just a lot that apparently we needed to do this morning that was of the utmost importance.
I mean, I think it's interesting because we all know when bulk trash is.
Okay. There's so much
Am I
at our
getting you in
house.
trouble right now?
No. You're not getting me in trouble.
He's wading into waters right now. I can see him like his hamster wheel churning. He's like, what can I say that will not set off Brooke?
When she does listen to this in 4 weeks.
She's our only listener.
I have 4 weeks. In 4 weeks, she's going to have a baby. She won't be able to listen to this podcast.
That's true. Then we could really go.
Yeah.
Go way off.
Oh, man. That's kind of wild to think.
It is wild to think.
Well, anyway. No, she just decided there's so much had to get done this morning that was not. I like to know what the plan is. Like, if you tell me, hey, tomorrow morning we're going to wake up, we got to wake up early because I want the house to look really clean because your parents are coming over tonight.
Yeah.
So let's do this, and this, and we can, you can decide what you want to do tonight, what you want to do in the morning. What I don't like is being deep in sleep and just like, hey, we're doing this right now. Get up. I'm like, what? Huh? then I'm out of sorts and then I'm pissed.
Yeah, I could tell. Energy was weird this morning.
I came in with a weird energy.
You had weird energy, and I could tell like right now, off the bat on this podcast.
We're gonna get back on track.
You gotta get back on track. You have no choice.
I'm fine. I'm good.
Yeah, you gotta get back on track here. So I know that you had a bunch of things to do this morning. Probably paint cans out of you can't even throw paint cans out. I'm assuming you threw some paint cans out.
No, it's not paint. It's boxes and bags of leaves. So many bags of leaves.
I just dumped them on the fucking road. let Mother Nature
blow them into our neighbor's yard.
Look, if it's off my property line, what happens, or if it's at the very edge of my property line near the road, what happens after that is God's will. Sometimes it blows back onto my property. Sometimes I get a westerly wind. Sometimes I get an easterly wind.
A westerly wind.
You just don't know.
All right. Are you ready to talk about the history of chiropractic
Oh
work
my
in America?
God. Okay. So today's episode
Yeah.
is specifically about my wonderful profession and the kooky bunch that we all are. It's a very
Yeah.
kooky bunch. And I don't want to skew, I don't, my worry about this episode is it may skew a little negatively.
Yeah. Because there's a lot of good that has come from that profession that I don't know if it would have made its way into general practice in like a physical therapy setting had there not been a more willingness to explore from
Yes.
like outside like the what do you say the standard medical
Standard
community.
medical, which in circles, the verbiage is allopathic.
Yeah.
Allopathic, I don't even know what the definition of allopathic means, but to me, the understanding of it is it's the medical system,
Mhm.
which,
Versus homeopathic.
yes. So, and in the medical, look, I would say I'm more towards the allopathic care.
Mhm.
And we talked about this a lot in our apple cider vinegar episode, which is, look, none of us doctors are right 100% of the time.
Mhm.
And oftentimes, because it's the hegemonic, dominant part of our medical culture, that you immediately go see a GP and you just think that your GP knows everything.
Yeah.
But it's impossible for
Yeah.
one very small slice of the medical culture or medical community to know everything about everything. That's why we have specialists.
Correct.
And
Correct.
like think about how individualistic and like how every human being is going to present differently, and they're going to have different needs and
Yeah.
different wants and needs for their own healthcare.
Absolutely. So when we were talking about this episode the other day, uh, we had some areas of the chiropractic community that we wanted to cover, and so I was going to kind of go down in what I feel like is a good order, ask you some questions so that
Yeah.
I think you can clear some things up for I think a lot of people, and this is just whenever you have a community that is very far reaching and has a lot of tentacles in different directions, it can be confusing to the patient like what they're going to experience if they go to a chiropractor.
Yeah, I mean there's so many different types. We are going to try to whittle it down to a couple of
Mhm.
categories and to simplify it, uh and to maybe, again, I think it's to each their own, and everybody needs, I'm not everybody's bag. I already know this. And you've seen me do this, which is sometimes I will tell
Yeah.
patients like, I am not
Not
I'm
the
not
person
your
for you.
person for you. I know I can fix it,
Yeah.
but you're not going to like the way that I'm going to fix it.
Right.
And that's fine. I can have, I've been doing this for so long that I have a sixth sense when I meet a human
Mm-hmm.
or a patient. I just know that they are going to have a bad outcome out of this just because of many variables. But you have to be able to trust your doctor. You have to have a relationship with your doctor of some
100%.
sort,
Yeah.
because there has to be a lot of open communication. And if you can't openly communicate with your doctor, you feel like, oh, he's going to judge me if I say this, or so on and so forth. You're not getting 100% of your health care, which
Correct.
is
Because they
where,
don't have 100% of the information
no,
to make the right diagnosis.
no, they don't have the 100%. And that's the thing is, you are out there, you might not be getting the outcomes that you want or need,
Mhm.
but you also might be withholding a lot of
Important.
important
Yeah.
information, and that could also just boil down to a thing of, I just don't trust my doctor,
Right.
or I don't feel comfortable, right?
Or
Like,
you're embarrassed. Like
or you're embarrassed, yeah.
it's I feel like almost weekly we have someone come in and they're recurring. Like they've at least come 4 or 5 times, right? And you can see the confusion on your face because you're like, I don't know why this isn't getting better. And you'll kind of ask them some like leading questions, and then eventually the third question will be like, well, I did go and do this. And the look on
Yeah.
your face, you're like, there it is. It's like, okay.
Yeah,
Now
and
now we know. It always cracks me up because it's like, well, I did do this. And it's like, that's the issue. You just
yeah,
didn't want to
or
tell me.
for whatever reason, they
Yeah.
will not tell me that they got a corticosteroid
Oh
shot.
yeah.
And then I'm like, oh, yeah, okay, this changes everything.
Okay. Thanks for
Okay. It's just
yeah.
not, we're gonna take that and now we're going to
Hmm.
explain why this is the way that it is.
Right, right.
But again, like it's really important. And remember, this is just one man's opinion and statements. I'm gonna just try to be as description based
Yeah.
rather than. I mean, I can't help myself. I'm gonna tell you that I fucking hate this part of
Right, right.
our profession. And also, just remember, it's a few bad apples often fuck up the bushel. I don't even know what that's saying. Did I say that right? Is that the saying?
I think it's pretty good actually. Yeah. I wasn't sure where you're going at first with it, but then now I think
Yeah,
that
a
is,
few
yeah.
bad apples ruin the bushel,
I
or
think
they.
that's
I
the
think,
gist.
yeah, the gist of it is they fuck up the bushel. This is this happens with surgeons. It happens with lawyers. It happens with every profession. That there's some jabroni out there
Yeah.
that fucks it up, and then it becomes a fucking huge story. But remember, news is supposed to be news. It's supposed to be sensationalized. But
Yeah.
that's not necessarily to be generalized.
Correct,
If you
correct.
look at the majority of it, I think that most people in this profession want to help people,
Right.
and they're trying to help people the best that they can,
Yeah.
and with the knowledge that they know.
Yeah. And some people
And
are just dumb, so they don't realize.
yeah, seriously,
Sorry.
there
Okay.
are really dumb people out there.
Yeah. So I think the best place to start is just to get your overarching, whether you want to call it a methodology,
Mhm.
philosophy. What is your
Mhm.
philosophy of chiropractic care?
That's a good question. My overall philosophy is I am going to take a lot out of like allopathic care.
Mhm.
So I tend to be more towards the medical sports injury, sports orthopedic part of the pendulum.
Mhm.
And I will add in all of the wellness and kind of homeopathic remedies for it. And really, the basis of it, what I believe and what my philosophy and the philosophy of the clinic is,
Mhm.
one, you just have to be really knowledgeable in sports injuries. So a bigger portion of our appointments are asking a ton of questions and figuring out what actually is the root problem. Like
Mhm.
we're trying to figure out, okay, one, what the diagnosis is. So let's just say it's tennis elbow. So I'm going to ask you a lot of questions about your tennis swing and what you might have been doing that week, what your workout program is, if you've had this before, what your history is of elbow pain, so on and so forth. What kind of elbow pain is it? Is it sharp or is it dull? Do I have any neuro symptoms with it?
Yeah.
All the questions. Have you had a corticosteroid shot in it before? What's your whole medical history? Do we have MRIs on it? I think history is like 90% of figuring out what's going on. And there you will go to chiropractic clinics and you might say like 2 minutes of history and then they figured it out. I
Mhm.
promise you
They didn't.
they did
Yeah.
it. That's that's your first yellow to orange to maybe even red flag
Yeah.
that this is not the place for you. Um, and so I think that that's our first thing, and then figuring out what the diagnosis is, and then figuring out where the root cause is, which is somewhere along the body there's an inefficiency and you're overloading that area. I mean, the most simplest terms, I'm trying to find the root problem. And for us, we frame it in the philosophy of movement. Like, I have to see how you are moving and whether or not you are moving efficiently for your particular sport.
Yeah.
And that's not necessarily like the efficiency of a volleyball player, the movement of a volleyball player is different than an efficiency of a soccer player, right?
Swimmer.
Or a swimmer or whatever it may be.
Yeah, because what would you venture to guess as far as like a percentage? I always tell people like injuries don't happen in a bubble.
Yeah.
Most of the time they don't happen in a bubble, meaning like there's not just like a completely random event.
Unless it's actual trauma.
Like a trauma impact. But and then even in some of those cases, like in the instance of someone, I was talking to a football player the other day and how he broke his collarbone. Like the way he fell, the position of his arm, all of those things, you know, are how the collarbone was in a weakened position, a position where it's, you know, going to break. But what we've also learned is you can reduce the chances of that if you have like a lot more mobility in a position than most.
Yeah.
Not always, but
Not always.
like you'll see sometimes someone gets tackled from behind and they fall on their leg a certain way, and if they had more ankle mobility, they might not have snapped something.
Yeah, right. I mean, how I view mobility and range of motion is it's like a shock absorber, right? And if you have more mobility, you're able to absorb some of those forces a little bit more and be able to distribute it a little bit more evenly.
Correct.
But if you don't, then it goes immediately straight to the next thing, which is usually your bone or your muscle.
Or the next joint up.
Or the next joint up. So either, let's just say your ankle doesn't have good plantar flexion or dorsiflexion. Well, if you get jammed in that position in dorsiflexion, it's either going to go straight to your ligament, which is all the ankle sprains and strains, or it's going to go into your calf, or it's going to go into your knee or your anterior tib or the bone. Like there's force needs to,
it has to go somewhere.
It's physics, people. So if a force is coming into you, it's got to dissipate somewhere. It just doesn't.
Every action is equal and opposite reaction.
Yeah, it doesn't go into a black hole and it's just like, oh, it dissipates. It's being absorbed somewhere. And so if you're not mobile, then it's going to be absorbed into either your ligaments, your tendons, your muscle. It usually goes ligaments, tendon, muscle, bone.
Right.
If it's big enough, it's your bone. You're totally fucked.
But ironically, one of the easier things to rehab from is just a clean break.
Yeah.
I would take that than like
sometimes.
An ACL tear and a.
But also, if you break a bone, then you oftentimes also have ancillary.
Correct.
Like you're not breaking a bone and not fucking up a ligament or a tendon on the way too.
Rarely.
Yeah, rarely. And that is our philosophy at the Sports Pod. That's has always been my philosophy. That's always been my vision, which is I really marry the two worlds as best as I can, and I'm a little bit heavier on the medical
sports ortho type.
Yeah, side. I'm heavier on that area because I've studied a lot and I have a ton of experience in just sports in general. So when we're talking for 10 or 15 minutes in your history, I can basically narrow down what the diagnosis is. And then once I do that, I can reverse engineer as to why the fuck this happened to you.
So where I felt like would be the next best place to go, and this is what seems like an interview at this point, is where do you feel like that philosophy came from? And I'm going to kind of lead you in one direction first. Do you feel like the education system is different in America versus Canada, where like maybe you go through where you went to school and what looks different about where you went versus the general education system here for chiropractic?
I think chiropractic schools are just like any other colleges in America and also in Canada. And I think both countries have different values.
Mhm.
And that's, again, okay.
Yeah.
And in America, it's a very, which is a huge issue in America. The cost of education here is ridiculous. You have to essentially mortgage your home. I don't even know what it is these days. I think SMU is probably over 100 a year,
I think it's
close.
60 to 80, 60 to 80, I
Yeah.
think. Something like that.
And I think chiropractic school in in general is about 120, 125. So a year. And let's just say that's 4 years. You're paying essentially half a mil. You're half a mil in debt as soon as you get out. And it doesn't necessarily represent what the market is. Because you're not making at the beginning, you're not making that type of money. I mean, no
No.
profession
No
is.
profession. Yeah.
No profession is. Uh and it's hard, and this is part of the reason why, there's a cannibalistic culture with your young doctors, and it's very hard to make it out. And in school they're telling you like that you're going to make this much, blah blah blah, but that's after like 10 years of practice. It's not, you're not good when you come out. You're not valuable to any clinic when you for you, the if you go to a good clinic, the first year or two they're just teaching you everything, which is like an education, and you should look at it like that should be when you look at your salary, it should look, that's reflective of, we live in a culture where everybody feels they're entitled to X, Y, and Z. And I don't necessarily blame this next generation
Mhm.
of doctors, because they've been fed this narrative that this is what it's going to be. And then when they get out,
Yeah.
they're like the only jobs that pay that type of money are big conglomerate chain, and they're gonna work you like you've never worked before, and you're gonna get disenfranchised, and you're also gonna get dumber in the process, because they're not
It's very cookie cutter.
it's cookie cutter, and what they're doing is they just need hands and bodies. They're not asking you to be smart. They're not asking you to like really think through it, and they're not necessarily training you to do so. And
And
so,
the business model doesn't provide enough time
no,
to
it
even do
doesn't
it that
provide
way.
enough time, and also you're just a number to them, and their churn is high in those positions. But I get it. You have student loans you have to pay back immediately, and you have to live somehow.
Yeah.
And that's the way. I never thought that. For me, that was never a priority for me. I would have. I mean, I can live on nothing. I did live on nothing for a very long time. Every penny that I made, I just went back to continuing education, just because I'm passionate about it, and I wanted to be the best that there was, and I knew that it would pay tenfold on the back end. So for me, everybody's situation is different. I'm not judging their situation. For me, it was really important to be put in a situation and in a position where I could learn as much as I could possibly learn. And in my first couple of positions, I learned a ton. Um, but going back to your original question, which is like, what is the difference? Every school is a little bit different. There, and this is really important to explain. In chiropractic, there is a continuum of philosophies,
Mhm.
and on one end of the philosophy is very spine based and joint based, and the philosophy there is very, I don't want to say this in a derogatory term, but in in the only description I can make is like less scientific. It's about, they call it the innate, which is, I don't know, your life force in your spine. I don't really know how to explain it. But
Relate
their
some of
their
it.
whole thing is everything emanates from your spine, and that's where the adjusting or cracking comes from. There.
Do you do you feel like that, or not? Do you feel? I'm sure you might know this, but did a lot of this care, does it come from like Eastern medicine, Western medicine? Like where was this first, like you hear about like reflexology, you hear about
where was it
chakras.
founded? Okay,
Yeah, like
the okay. Here's a
I feel like I'm leading you on a
oh
tangent
my
because I
God,
love
know,
it.
but okay. Which is like this is a very different thing again with Canada versus America. And the only reason I know how American schools work is because I used to work at an American
That was where we're going
chiropractic.
next.
Yeah.
If we ever make it out of
If we ever
this.
make it out of this fucking deep dark hole. In Canada, you have about one like half a semester, not even like one month of chiropractic history. And the chiropractic it's which is wild. And I'll be the first to tell you. There's in Canada there's 3 exams that you have to take, and in America you have to take 4 exams. And one of the exams in America is chiropractic history. Like I don't know why you have to take this to be a good doctor. I think it's fucking completely asinine. But you have to be quizzed or examined on
Oh, jeez.
chiropractic principles, okay? And all of that is like the history of chiropractic. We don't learn this in Canada. It's like a
Interesting.
very small portion of our curriculum, like very minute, maybe 1% of our curriculum. And it's in our first year, and it's just kind of like an introductory class. All of our classes in Canada were heavier on sciences,
Anatomy, kinesiology.
kinesiology, physiology, rehab, so on and so forth. And when I came to America and I had to do that test, I failed that test like 3 times. And there's always a comment box, and I would always write a fucking like
Scathing review.
1,000
Oh.
word essay of how stupid this exam is and how it's not reflective of if you're going to be a good doctor or not, and how I mean, I probably wasted $2,000 just redoing that part of the test, just because it was so fucking stupid.
Yeah.
But the history of chiropractic is there are many like different interpretations, like there are many different interpretations of the Bible.
Yeah.
But the simplest explanation that I can give you is there was a janitor. There was a janitor
Okay, where is it?
at a school, and he couldn't hear out of like one of his ears for whatever reason. And there was I don't remember if it was like
He slipped
BJ
and fell weird and
No,
cracked it.
I have no idea. A BJ Palmer or one of the founders of chiropractic was like, well, let me just try something. And he adjusts the guy's neck, and then suddenly he could hear. And that was like that is when chiropractic was born.
This literally just, it sounds like the start of any religion.
Yes.
Like,
Is
I saw this guy perform this miracle. He
yeah.
must be.
Yeah. And my whole thing about how okay, so the people that are on this side of the chiropractic end, which is like innate and blah 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 and all that, they want to like safeguard the history and the fundamentals and the foundations of chiropractic. But my whole thing is like, how are we advancing this profession? Would you ever go see a dentist that was like, I want to do dentistry that they did it like 100 years ago?
No.
Absolutely fucking not. You'd be like, give me the fucking Novocaine, give me the laughing cast,
Right.
do all the new techniques. You would never, if you had a fucked up knee or you needed surgery on the knee, you wouldn't do it the way that they did it in World War One, where they were like, bite on this fucking piece of leather, take a swig of this whiskey, and we're cutting. No, you would never do that. And so I don't really understand why people in chiropractic want to safeguard the history of chiropractic. Like, there are people that want to keep it fundamental, and then there are people that want to continue to progress it. And I'm not on the end of wanting to progress it, but there are people out there that don't.
They want to stay purist almost in a
Yeah. It's just and they are, not to get into politics, but they are like the fundamentalists that want to keep the amendments. Like they read the amendments as this is what the amendment is. This is how the amendment was interpreted in 1887.
Which was like my first, the first time I came in contact with a chiropractor was early in my weightlifting career. I say career, it wasn't a career. I just liked doing it. But I was at the American Open, and a lot of these, whenever there's big events, whether it's CrossFit, weightlifting, they'll generally bring in outside practitioners to be there for the athletes. So they have a bunch of tables set up. It actually might have been the Arnold Classic was maybe the first time, now that I think about it. But I had a tweaked hip, as I always have forever. And this, person, I was like, okay, I'll go like lay down and see what they can do for me. And I remember it very clearly. It was just like, pulled my feet, looked like left, right, see like, I was like, what is going on? Like to see. And I remember even at that moment thinking, okay, well, my feet aren't fully lined up, but also my hips, the way he was pulling, I felt like this. Like if you just pull my other leg a little bit further and even my hips up, my legs would have been straight. Like I felt like, are my legs really a different length right now? And then he just started like, it was just crack, crack, crack all the way down, and then retest, see how my legs lined up. And I mean, I felt a little better when I got up, but also it's like, like when you get some relief from just cracking a knuckle, it kind of hurts. You crack a knuckle, you're like, oh, it feels a little bit better. I was like, I don't know if this is going to like actually solve anything.
Look, this is one of my pet peeves, which is you've never seen me at any of these types of events. And it's, I get it again. It's not judging. You have to get your name out there somehow. And you want to help athletes, but to just be willy-nilly rocking somebody's body like that without taking a good history. I mean, this is how doctors get into trouble all of the time, where they hurt somebody. It's because he didn't say 2 words to you. He just started doing his thing.
I was like, hey, he was like, what's going on? I'm like, when I catch clean, my hip hurts. It's like this and here. He goes, okay, let's look at it, and he just
started rocking. Like,
he didn't watch me squat.
No, exactly. So, and that's what gets you into trouble. And again, leg length discrepancy is what you are describing. Can mean a million different things, and it can mean it could have happened from 100 different ways, and it's all it's subjective. It's like not an objective measure. It's not an objective measure. And that is the type of shit that drives me nutsos.
Yeah.
Yeah. I mean, anybody who does if that's another red flag is if you go to a doctor and the first thing that they do is a leg length discrepancy, and then they go click, 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 adjust. Look, it's fucking normal. Like, well, first of all, how did you know it was abnormal in the first place? He's the only person that saw it, and then he's the only person that's seeing it afterwards. To me, it's like no different than the fucking kiosk guy at the mall with the fucking magnetic bracelet, and he's like, put your hands out. Okay, look, I can push your hand down. Put this magnetic bracelet on. Do you see how much stronger you are?
Yeah.
Dude.
Which it's just simple like magic tricks that you just learn. It's like, oh well, after you've done something once, your body knows how to resist it better the next time. Yes. So it's
an adaptation. It's a neurological adaptation. That's what it is.
Yeah.
Which again, one of the things we did talk about, and I said this to an athlete today, or not today, but yesterday or sometime this week, which is placebo effect is a real thing. Mm-hmm. And I'm not shitting on the placebo effect. If you told me I don't have to take an Advil, I could take a fucking sugar pill and still feel the same way, I fucking take the sugar pill. Less effect.
Yeah.
So, look.
In baseball, remember when everyone was wearing those like necklaces?
Yes, it's so stupid.
And it became a thing. Every pitcher had this like necklace on.
Or the soccer players who get the fucking spray on their knee, like the trainer comes out and just sprays their knee. It's like, it's magic spray. He can walk again. Look, I'm not discounting placebo effects. I just want you to know that it's a placebo effect. That is not nothing has really changed long term. It's changed short term. Fine, great.
Yeah.
But just know what it is. It's not anything else than that.
Yeah. So next on the list, there's a lot of different types of chiropractors. So what I wanted to get is your description of like a subluxation
Yeah.
focused chiro versus
Yeah. So let me just talk a little bit about subluxation doctors, which uh if a medical doctor heard subluxation, they're thinking like excuse me. They're thinking of a complete dislocation.
yeah,
And
your shoulder subluxed
yeah,
out of the
right.
socket. Yeah.
And these are the doctors that in the chiropractic world, these are the doctors that say like your low back is out. Your whatever
Threw it
reason,
out.
you're threw it out. You're just out. Which again, explain to me what fucking out means.
He
Are
took
you out? Are you like out of the closet?
he took it out.
He took it
out.
out.
It's a Seinfeld reference for you guys.
Yeah, so they're saying that your spine is off, and the subluxation doctor can feel this by their hands or intuition, and then they're adjusting you. Now, science tells us that there is very poor inter-doctor reliability on this. So if I feel like your L5 is out, the next doctor is trying to feel, they might say it's L3. This is just scientifically... They have proven
tested this.
They've tested this. So the reliability is very low. And there's no science that shows that your shit is out. There's none. They've MRI'd it.
Well, I think you can
it. And so those subluxation doctors, they have a very quick, and you might go to one of these doctors, which sometimes they have this machine that they're measuring the electrical impedance of your spine, and they'll be like, this side is really red and this side is really green, and like that means that you're somehow aligned. And then they're going to adjust those areas. Those are usually the 5-minute doctors, right? Like you're going to go in there, some assistant's going to go in, they're going to go bam, 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 you're out at C1, C2, C3, and they're going to show you this piece of paper that says that you are out, and then the chiropractor comes and then adjusts you, and then you never see that person ever again. Or like and then they'll say, I need to see you like 4 times a week for the next 18 weeks to the year to years, and then we'll never keep you. You're always going to come back. I mean, which is in the business world is like, this is a forever subscription model.
Yeah.
You're going to Netflix chiropractic.
You cannot share passwords.
So that's what a subluxation doctor is.
Okay. So with that, because you talked a little bit about how they solve these issues, I think the next logical place to go is talk a little bit about the different techniques that you'll see used in this world. So like from a myofascial standpoint, there's a lot of different ways to treat tissue.
But in subluxation world, in the subluxation world, these people. What do you mean? What do you mean these people? What do you mean you people? Where's that from? I don't know. These types of doctors will use multiple instruments. So the first one that comes up to mind is called the drop piece. And I get asked this question too, which is on the table, they'll be able to lift up that table a little bit, and then they'll be able to push on you, and then that piece slams down. And the whole point of that is whatever force I'm pushing into you is coming back up at you. So they're saying that it's faster than a normal manual adjustment. It's because you're using this drop piece that creates an opposite reaction coming back at you.
Oh, I've never seen that before. Okay.
Yeah. And you again, if this, because you'll see this, and again, this is just my opinion. This is not like for everybody. You'll see this with people that are trying to adjust your extremities, like your wrists and your elbows and your shoulders and blah, blah, blah. Or you might see this with smaller practitioners that just can't force it. You know what I mean? They just don't have the strength to do it, so they'll come to that. That's one. There's a completely different technique called activator, which is that little clicky thing, click, 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 click.
Oh yeah,
And they'll like put it on your spine. Their whole thing is, they believe that a lot of it emanates from your spine, and they are the ones that also leg check, like they discrepancy check.
Mhm.
Which, can you guess how much one of those clickers costs?
Well, now you're leading it, so I'm gonna go high. I'm gonna say $1,000.
More than that.
No.
Some of those ones. So now they have obviously like the Tesla of the activator,
Mhm.
which like can somehow detect your shit. And it's a machine. It's like AI. I mean, I'm sure there's an AI version at this point. Like, there's just going to be a humanoid robot that does this. But it's like $5,000. It's $5,000.
It's insane.
It's insane. It's insane. And I'm not a big fan of activator. I honestly don't.
Why aren't we creating devices to sell to all
I
these
know,
other people? That's what we should
so
do.
stupid. I imagine whoever is the owner of activator must be fucking filthy rich.
Yeah.
But I mean, that's what they do, and you'll know that it's this thing that clicks, and they're saying that is putting a force in your spine 1,000,000 times fast, the speed of light into your spine, and it's adjusting it.
Oh my God.
And that's what activators. So these are instruments that you might see a subluxation. The best way to know that you're at a subluxation doctor is literally they will spend about 5 minutes with you. They might not even know your fucking name. It's just churning. And there are some so just again as a reference point, those clinics will see 100 people a day. A day. I might see at most 12.
Yeah.
I don't even come close to seeing 100 people a week.
Yeah.
That's
That's
crazy.
absurd. Yeah.
It's crazy. It's crazy.
Okay, so moving on. Let's talk about we did talk a little bit about tools right there, like percussion tools.
Yes.
That would that fall under a percussion tool?
No, the percussion tool is, what do you guys call it in that fucking percussor thingy, the hand vibrator fucking thing?
Oh, yeah, the Theragun.
Theragun. This is a very popular tool, and oftentimes I get asked like, well, should I smash with this ball or should I use the percussor tool? And I always say smash on the ball, because your muscle needs constant force to know what the fuck is happening. But if you use a percussor, it's more of like a neurological thing, which is it makes it feel good because you're essentially numbing the area a little bit. You're confusing the muscle and the neurons in that muscle, the neurons that connect to that muscle, and you feel better, but you're not doing anything.
Correct.
You're just warming the tissue up.
Which is what I usually tell people. I'm like, look, if you want to do it right before you work out, so that's
great.
Yeah.
So
you're not like doing some weird compensation because of the pain to kind of go away from the pain.
Yeah.
But just know, like you said, you're not solving the underlying.
Yeah. And again, the
issue.
doctors that are using that is just because they don't want to use their hands. That's it.
Yeah.
I mean, that's again my opinion. It's an easy way to do, just to tell people that you're doing soft tissue work,
Right.
In a way in which you're really not doing much.
So I gave you like my first experience with a chiropractor. My second experience was a little bit different, and I felt like I went to the other end of the spectrum. Was very little adjustment.
Yeah.
Like none.
I know that doctor. I know the doctor that you're talking about because I heard you talking about it over the.
Okay.
And that doctor also at that time was doing a ton of kinesio tape. Like he had like rolls of tape, and it was like this whole thing had the fucking nice sharp scissors. He's like, "What color do you want?"
He was big in kinesio tape at the time, and I think everyone evolves as they learn new things and try out different methodologies. But he was really big into ART as well.
Yes.
And every time he was the first person to ever like. No, I want to say fix my shoulder, but it was like the first time he was like, this is why your shoulder keeps getting fucked up.
Yes.
And he was the first person who dug his thumb up into my armpit and like opened me up. And I was like, oh my God, what just happened? Yeah. So that was my first experience with like, I asked like, what is this? ART, MAT? Like he went through some, like, this is like the type of manual therapy I'm doing. And it was the first time someone said, like, your muscle takes a long time, like you need to change. And so I remember some of that treatment, it hurt so bad because you're just on a spot for what feels like an eternity.
Yeah.
And then eventually you're like, oh, okay.
Yeah, and that's the science of trigger point therapy, and we can do a whole podcast on just the trigger point therapy and like the science behind it and the if it's valid or not valid, so on and so forth. I think just to gloss over that and remind everybody that muscle takes a long time to change, and you need to create constant inputs to the muscle to create change, or the muscle has no reason to want to change. It's just like it's like human behavior. Like you have to have some type of stimulus that is trying to create a reaction. And so this goes back to the differences of chiropractic, which is some chiropractors just believe everything happens from bones and nerves. And there's some people that believe that the philosophy is like it comes from muscle and your neurology and so on and so forth. So, again, we tend to be more on the muscle side and the movement side. And it's, I would tell you, on a business sense, it's hard to make a good living doing the muscle work stuff because people don't necessarily value it. It takes a lot of time. I mean, I wish that I could be the doctor that could see 100 patients a day at $25 a pop. Then I'd be much more financially comfortable than I am now. I'm not complaining. Just like integrity is, I want to help people, and I know this is the best way to help people. Those doctors might feel like that. I feel as though, as my opinion, this is just my opinion, it's just another way of not using your brain. And this is why we get such a bad rap, is those doctors are not necessarily taking good histories. And oftentimes, again, knock on wood, those are the doctors that, like, when you hear somebody getting like a neck adjustment and then their patient strokes out, one, the science is essentially you have a better chance of stroking out from aspirin than you do from a neck adjustment. But it's in the news, and it's like, people are polarized on it.
And if you do enough things, you're going to eventually have someone who just, the coincidence is just going to happen eventually.
Right. If you're seeing 100 people a day and you're just adjusting their necks and not taking a history, that's going to happen to you. Right.
And I will say you're probably seeing a little bit of a lower socioeconomic clientele, maybe someone who's a little bit more overweight or unhealthy. A lot of the people that we see, they're athletes.
Yeah. But like, look, if a patient came to me and was like, this is the worst headache that I've ever had in my entire life, and I can't feel my left arm, and I like all the signs of a normal strain, like I'm slurring my speech.
Don't adjust.
I'm not touching you. You gotta go to the emergency room.
Yeah.
But this is the difference, right? Like quality versus quantity. I'm taking the time to actually ask these questions and being like, have you had heart problems before? Do you have incidents of heart disease in your family? Do you have high blood pressure? Let's take your blood pressure. Like, these are the things. I'm not, and again, I hope to little baby Jesus that it never happens to me, because again, it can happen to anybody, and I feel so bad for the doctors.
Well, I feel terrible for, I owned a CrossFit gym for a very long time, and I was very lucky to never have anything catastrophic happen at the gym, besides like, a shin get destroyed by a box, on a box jump. But I do know gym owners that had people have a heart attack on a rower, like just warm up, 500-meter warm up, like die. Like I terrible shit. And it's
terrible for both parties, right? Because it's a no-win situation.
Yeah.
But like, our profession doesn't do ourselves any favors, because there are clinics that run like that, and that's what ends up being sensationalized, right? No one's doing a news story on me when I rehab an ACL in under a year, and they, you know what I mean, and they are all stars at in the MLS.
Yeah, does anyone know who helped Adrian Peterson come back?
No, they
No, you just know that Adrian Peterson's a freak, but
yeah.
someone was like involved with that.
Yes, somebody was involved in that rehab, and so I when I see things like that, when I see things on news, like this is why people are skeptical, because the news is just the news is supposed to be bad. This is what gets clicks and eyeballs on
Yeah,
it.
you're not watching mundane.
No, and
Sensational.
so, again, it happens so rarely, but it does happen, and it tends to skew more towards the doctors that are more subluxation based.
Yeah, that makes sense. All right, let's finish up on a good one. Let's talk about the different categories. I guess they be called categories. So I'll give you a few. Your pediatric versus neuro versus.
Yeah, there are different categories of chiropractic. There are neurochiros, which only focus on the neurology, and they truly believe that everything is coming from your brain, and they have all these techniques to get your brain to get moving. And sometimes that involves adjusting the neck and so on and so forth.
Okay.
But oftentimes there are different, like, it's just a completely different skill set. And I would say, if I had like a concussion patient that I could not get better, I would just send them to a neurochiro, because a neurochiropractor would be able to fix the concussion quite quickly. And it for me, in the industry or in the profession, this was like mostly highlighted when Sidney Crosby had a ton of concussions. Sidney Crosby,
Yeah.
for those who don't know, one of the greatest Canadian hockey players of all time.
It would have been even better if he wasn't
Concussed all the time.
How many seasons total in his career?
I remember
3?
in his early years, he's missed like almost complete seasons, like a full season of hockey, just because his concussions were so bad. And it's like, I mean, there was a time where concussions was a very highly talked about, trendy thing to do, or to talk about, not to do. I don't want anybody to have a concussion. But there are very specific, essentially brain chiropractic doctors. They are just neurology. There's whole conferences on it. There are whole certifications on it. There are people that dedicate their lives on just trying to study the brain. I tip my hat off of them. It's fucking way over my head. I don't know any of that shit.
Okay.
It's nutsos. Then there are pediatric doctors, which are very specifically chiropractic for like infants, babies. They generally, and kids, and they generally specialize in like pregnant women. So like Webster technique is one of those things where if your baby is breached, you might go to a pediatric chiropractor and try to get that baby not breached. Those doctors also usually do, forget what it's called, but it's like craniology or something along those lines. Somebody, Brooke could, I wish Brooke was here so she could just be our producer. But the sutures in your head when you're a baby, they're not fully formed.
Right.
And you can do techniques if your child has like a malformed head. You can do techniques to make sure that that skull is being.
And you'll see babies with the helmet on.
But you would go to a pediatric doctor that does specifically that, like babies and craniology and all that jazz.
Okay.
Then there's the subluxation, which we already talked about. And then there are the rest, which is, I mean, there's sports, and there's really true sports. And then there's people that call themselves sports. Now, I think that is really important. Again, if you are an athlete and there's like any type of like auto injury, or in the description they're like, we do auto injury and sports. Run. It's not a sports. It's not a sports practice. No. It is only an auto injury practice. 90% of their patients are from lawyers, from an auto, and that is like to be honest, like the sleaziest and like worst industry to be in. It's like no one wins. I mean, the doctors are just trying to get paid. The patients are trying to get to a
trying to fight to get paid.
Yeah, it's just the absolute worst. It's so bad. And I only know this because in the beginning of my career, I did it for about 6 months, and I wanted to jump off a bridge because it was like it was the least fulfilling, worst type of patient.
Well, there's no incentive for them to get better either because
No.
they're trying to,
Game the system.
yeah.
Everybody's trying to game the system in that whole. And so those are like, I would tell you, those are the kind of main types of chiropractic. And I mean, the last category is like the doctor that's just in it for the business model. Like they're just
The pill.
yeah, they're I don't, and I think they might have banned this now, but any doctor that makes you prepay for like 100 appointments up front, again, you should just walk away.
That's insane.
Yeah, there were clinics that were like, well, I need you to pay me 5 grand up front, and we'll just like draw from that for the rest
Like
of the
you
time.
have me on retainer.
Yeah, essentially, and it's like, what?
Yeah, that's wild.
That's wild. But this, and I went to this conference where that's all they talked about. And this is the thing. This is a side of chiropractic that drives me fucking nutsos. Like that counts as continuing education somehow. Like that was a continue educating, and this is why I can't stand our profession sometimes. Is that type of conference is under continuing education. Is like, how do you talk to a patient so that they can, like, these are like the maximized living, they call them maximized living. Like you'll go in, they'll show you this videotape, they'll explain to you why it's important to pay $5,000 up front so that you can, it's the worst.
And really the only person making money is the person who created those CDs and is selling that module.
Yes, it's
yeah.
There's a whole bag. Now again, I'm trying just to educate you. If you want to go to those types of clinics, just know what you are getting into. Yeah. That's what it is. If you really, I mean, if you really want help, then you can find the real help. But I think that there's just a lot of misunderstanding, and I think that there's, I think we also all get lumped into it. That's why, honestly, I don't really tell people that I'm a chiropractor.
It's not anywhere.
No.
In your face. Like it's, people ask sometimes, like, so are you a doctor of physical, only when people ask.
Yeah, I'll tell them.
Yeah.
And I mean, I have my shit hung up like that says Dr. Blake Wu DC, and it's on the website. But I just think there's such a negative connotation.
There is. I feel like it's getting better because there are
better doctors.
There are becoming better doctors.
There are. But again, I think we are the minority.
For sure the minority.
Yeah, there's a tidal wave. And again, I think that there are different variables to that, which is like, again, people are coming out with bigger and bigger school debt. They're being promised X, Y, and Z. They get desperate.
Yeah, so they have to go down whatever avenue is going to
pay your bills. Yeah. I get it. But I just, again, I was hard up for paying my bills, and that's part of the reason why I took that auto injury, but I couldn't do it for more than 4 or 5 months.
Yeah.
And it was like, I would rather default on my loans than
do this anymore.
Like whatever the consequence of defaulting on my loans at that time were much more appetizing than going into work and doing that type of work. And so those are really the like several categories.
Okay.
Yeah.
Cool.
Yeah.
Well, I think that concludes part 1